Hello, everybody. This is Laura Palagini. I am a psychiatrist and a researcher in the field of mental health at the University of Ferrara in Italy. We are here today thanks to AmLife they work so much for mental health and for our health in general. So I want really to thank them for the work they are doing around our health. So thanks again. Today we are here to celebrate the World Day for Mental Health, and for this we want to discuss about the important role of emotions in our life and for our health, in particular for our cardiovascular health. We know that we have a lot of emotions, a wide range of emotions in our life, but some of them, they can be bad for our health. In particular, feelings like sadness, anxiety, depression, anger, hostility, fear, shame, they are unhealthy for us. They may be related to a lot of disorders, including cardiovascular disorders. These kind of emotions, negative emotions, anxiety, fear, depression, anger, hostility, they are related to the hyperactivation of the stress system. So they may affect your cortisol and they may increase the cortisol. That's why they are related to a lot of disorders, including cardiovascular disorders. Some emotions can be deadly for us. Again, anger, hostility, anxiety, depression, resentment, repressed anger, and unforgiveness. These kind of feelings, they may promote disorders because often they are related to unhealthy behaviors. It's relating to exercise, diet, and sleep. And you are feeling bad because you are these negative emotions and they don't help you in dealing with stress in the everyday life. And then these negative emotions, they can in some ways affect the sense or the purpose of life that you have. On the other hand, good emotions, they may promote health because they are related to healthy behaviors, including exercise, including diet, including sleep, and they may help you in dealing with stress in the daily life, and so they may increase the sense of the purpose of life that we have. So you have to take care of your emotion because these negative ones, they can be really deadly. They can be a risk factor for a lot of disorders, including cardiovascular disorders. There is a wonderful connection between our mind and our cardiac activity, our heart. It is a very complex connection. It is a wonderful one. With your mind, you can control your heart. And so it's vital for you, for your health, to be healthy in your mind. On the other hand, these negative emotions, emotional distress, can be a risk factor for cardiovascular diseases, stroke, heart attack, and so on. In particular, we speak about emotional distress, and we include in this term all these negative emotions that we have discussed before. It seems that emotional distress is related to a risk of cardiovascular disorders, heart attack, or stroke, but in particular to hypertension. The risk could be doubled if you have this kind of negative emotions. There are some studies showing that women, they may express a greater increase in negative emotions and a greater decrease in positive emotions compared to men. So women, they may have an increased risk for hypertension and cardiovascular disorders, even if with age. All of us, we have the same risk. We are at risk for cardiovascular diseases increasing with age. In particular, these bad feelings like anger and hostility, they are really risk factors for cardiac attacks and coronary artery diseases. Before, we were used to speak about a type A personality that could be related to an increased risk of cardiovascular disorders. But now we know that the core symptoms of type A personality were anger and hostility. So if you feel that, please try to work on these bad feelings because they are unhealthy for your cardiac activity. It seems that these negative emotions, anger, anxiety, depression, hostility, guilt, these unhealthy negative emotions, they can be a risk factor for cardiac disorders, even if they are low, not only high negative emotions, but also low negative emotion can be a risk factor. So again, please take care of your symptoms or your anger, sense of guilty, depression, anxiety, and emotional distress. Anxiety symptoms are also, we know very well that they are risk factors for coronary heart diseases, and there are a lot of, studies. You can see this is a review, and the risk is there. So during the last 30 years, we can see that there are a lot of studies showing that. So if you have anxiety symptoms, please take care of them because they can cause coronary heart diseases. The risk is there. I mean, anxiety symptoms, they can be risk factors for new coronary artery diseases, but also for a recurrent one. So it could be a factor related to new problems, cardiac problems, but also to recurrent ones. And even if anxiety is just there by itself, it is not related to depression, it can be a risk factor for cardiac diseases, and the risk is there. Then depression, if you have some symptoms related to depression, we have to know that it's a very strong risk factor for hypertension, for example, in particular for those forms that are uncontrolled and that they don't respond to therapies. So, and recurrent forms that are difficult to treat. And I mean, depression is really among the new cardiovascular risk factors. During the last 20 years, a lot of studies have shown that depression, sadness, they are risk factor for coronary artery diseases. Traditional cardiovascular risk factors are age, increasing age, smoking habits, hypertension, diabetes, but now depression is there. We know that, together with inflammation. The risk to develop coronary artery diseases with depressive symptoms is very high, is more than double. And there are a lot of factors that may connect depression with cardiovascular diseases. As we know, we were discussing this point before. When depression is there, there is an hyperactivation of the stress system and the hyperactivation of inflammatory system. The autonomic system is completely off. There is a dysfunction in platelet aggregation and endothelial functions. So there are a lot of ways, pathways throughout depression can cause cardiovascular disease, but at least with the hyperactivation of the stress system, then depression is related to a lot of unhealthy behaviors for your health, such as often alcohol use, smoking, lack of exercise, poor medication adherence, or poor sleeping, unhealthy diet. Throughout all these pathways, depression can cause cardiovascular diseases. Even depression has been related to myocardial ischemia, or can be a cause of acute myocardial infarction, and for new ones, but also for recurrent forms of myocardial acute infarction. So it's really important to take care about symptoms of depression. This is a review that my group and we conducted some years ago, and we have found that not only depression, but the spectrum of depressive symptoms and emotional distress can be a risk factor for cardiovascular diseases in the long term. For example, is a part of depression if you feel, bad, dysphoric, irritable. Okay, even irritability is a symptom of depression and could be a risk factor for cardiovascular diseases. Or maybe if you lost your hope in the future, this kind of feeling is also a negative one, and it is in the spectrum of depressive symptoms and could be a risk factor for cardiovascular diseases. The risk is 3 times higher if you have this kind of feelings in which you lost the hope in the future. So if you have all this kind of spectrum of emotions, sadness, okay, but also you lost the hope in the future, you feel irritable, you feel tired, all these factors can be a sign of depression, and all these factors alone, they can be a risk factor for cardiovascular diseases. So it seems that these negative emotions, they have consequences. They may affect our health, in particular our cardiovascular health. In general, they use a lot of different pathways. I want to repeat this because it's important. These negative emotions, they increase cortisol, they increase the sympathetic activity, they increase, they alter the autonomic functions, and they alter the inflammatory system, and so everything is a big mess in your heart, for your heart, if you have this kind of negative emotions, and maybe you may be prone to have unhealthy behaviors such as smoking, drinking, poor nutrition, poor sleep. On this topic, I want to underline an important factor. A good night of sleep, firstly, is a therapy for our emotions. If you sleep well, you can treat your bad emotion, but if you don't sleep well, your emotion can be negative the day after. And also a good night's sleep. A good sleep is just a therapy for our cardiac activity, not only during the night, but obviously during the day, because we know that insomnia and sleep problems, if you don't sleep well, everything could be a risk factor for hypertension and cardiovascular disorders, including heart attack. It seems that if you don't sleep well, it could be also a risk factor for mortality for cardiovascular attack. So a good night's sleep is so important because it is a link. A good night's sleep can be a cure, a treatment for your bad emotion and for the alterations in your cardiac activity. So that's why it's so important to be here today, thanks to AmLife, to discuss the importance of dealing with emotions. So please don't ignore your psychological problems. And we are here just for this reason, to remember to everybody to safeguard our emotion, and because they can, if we don't, negative emotion, they can be related to cardiovascular disorders. So this is the importance to have events like that to discuss during the World Mental Health Day, thanks to AmLife, how to prevent these negative emotions. Obviously, if these feelings are very bad, it's important if you go and speak about your problems with a psychologist or a psychiatrist. You have to refer to someone. But if you have these feelings and you think you can you control them, manage them, it's important to have them under control. Try to be optimistic, because optimism is good for health, and to have a regular life, and especially for exercising, for diet, and a good night's sleep. You have to sleep very well to be healthy with your emotions and your cardiac activity. Then AmLife, they have a lot of activities to treat these negative emotions, the electropotential therapy and the deep sleep mechanism. They can help you on these negative emotions, and consequently they can help you for your health. But I think you will discuss about this therapy later. And so I just want to thank AmLife and for our collaboration in this for the last few years, and hopefully see you in person next year. Thank you so much. Bye bye.